Plexus, it's a network. And where it is present, and this network is going to that of the brachium, that's the arm. That's why it's called as the brachial plexus. Okay, so if there are network of nerves, so which nerves are involved in that network is that, first you have to understand a typical spinal nerve. Let's imagine this is a cross section of the spinal cord with its dorsal horn and the ventral horn. This is the ventral horn, this is the dorsal horn, and this is the ventral horn. And from the ventral horn there is a ramus called as ventral, this is called as ventral root. And from the dorsal root there is another one, dorsal horn, there is a root called as dorsal root, and there is a ganglion called as dorsal root ganglion. Both the dorsal root and ventral root fuse to form a spinal nerve or spinal trunk. And this trunk will divide into ventral ramus and the dorsal ramus. This is called as the dorsal ramus, which supplies only to the top, the dorsal side, and ventral ramus will supply both to the top lateral side with its lateral branch and also the anterior side with its anterior branch. Okay, in a cross section of spinal cord we have dorsal horn, ventral horn. Dorsal horn has a connection called as dorsal root with its dorsal root ganglia, and ventral horn has a connection called as ventral root. Both these dorsal root and the ventral root fuse to form a spinal trunk. Immediately the spinal trunk is dividing into dorsal ramus and ventral ramus. Dorsal ramus will supply to the dorsal region. Ventral ramus, through its lateral branch, it will supply to the lateral part, and through its anterior branch it will supply the anterior part also, or the ventral part. Now what I am saying is, please remember this ventral ramus. Why? Now we will discuss that in the brachial plexus. We have C5 spinal nerve, C6 spinal nerve, C7, C8 and T1. All these spinal nerves from C5 to T1 will form the plexus. It forms a network, and that network is called as plexus, right? So which part of the spinal nerve is forming the plexus? It is the only ventral rami. Singular, it is called as ventral ramus. That means ventral ramus of C5, ventral ramus of C6, ventral ramus of C7, C8 and the ventral ramus of T1. Only the ventral ramus are forming a network, and that network is called as plexus, called as brachial plexus. So brachial plexus is formed by ventral rami of C5 to T1. So please, the first statement itself is that it is the ventral rami of C5 to T1 that is forming the brachial plexus. So I am not talking about dorsal ramus, I am not talking about spinal trunk, ventral root or dorsal root. I am talking only the ventral ramus. From that ventral ramus, your brachial plexus begins. So whatever I am starting from C5 to T1, that is a ventral ramus only. I am not talking about whatever is present before it. Okay. So from C5, let's imagine this is a ventral ramus of C5. This is a ventral ramus of C6. This ventral ramus of C7, ventral ramus of C8 and ventral ramus of T1. And these ventral ramus or ventral rami are called as roots of brachial plexus, because that is the origin point. That's why it is called as root. Okay, don't confuse dorsal root and ventral root. That's a different one. I'm talking about the brachial plexus. The starting of the brachial plexus is called as a root. And what is that starting point? Ventral ramus. Okay. Now these roots together forms fusion forming trunks. How? I'm taking with another color. C5 ventral rami and C6 ventral ramus fuse to form upper trunk, whereas the C8 ventral ramus and T1 ventral ramus fuse to form lower trunk, whereas C7 will continue as middle trunk. So we have upper trunk, middle trunk, lower trunk, right? So roots are forming to fuse to form trunks. So roots are continuing as trunks. Now trunks will divide into divisions. Next is divisions. So what are the divisions? One is the anterior division for each one, and also the posterior division, which is represented in blue color. So this is the anterior division, whereas blue color is the posterior divisions. Now these divisions again fuse to form cords. So the next one is cords. How? Anterior division of upper trunk and anterior division of middle trunk fuse to form lateral cord. Lateral cord. Whereas the anterior division of lower trunk will forms the medial cord. Next, what about the posterior cord? It is formed by the fusion of posterior division of upper trunk, posterior division of middle trunk, and posterior division of lower trunk. All these together fuse to form. So the posterior divisions of all the trunks, upper, middle, and the lower trunk fuse to form the posterior cord. Sir, why it is called as lateral cord? Why it is called as medial cord? And why it is called as posterior cord? Simple. These medial, lateral, and the posterior is based upon the relations with that of second part of axillary artery. If any cord which is present medial to that of second part of axillary artery, that is called as medial cord. If it is present lateral to the second part of axillary artery, lateral cord. If it is present posterior to the second part of axillary artery, it is posterior cord. So everywhere I am mentioning the second part of axillary artery. It is not just the axillary artery, it is the second part of axillary artery which is present behind the top pectoralis minor. So based upon that, it is divided, it is given as lateral, medial, and the posterior cord depending upon the relation how it is present with second part of axillary artery. Okay, and these cords now will give branches. So the next part is branches. So what are the branches from the lateral cord? What are the branches from posterior cord, and what are the branches from medial cord? Lateral cord has three branches. The first branch is the lateral pectoral nerve. Lateral pectoral nerve. Second one is musculocutaneous nerve. Third one is lateral root of median nerve. Median nerve is not only formed by the lateral cord but also by the medial cord also. That's why, and later in that for that median nerve, it is formed by lateral root and the medial root. So lateral root is by the lateral cord, medial root is by medial cord. Okay, so three branches are arising from that of lateral cord. What are those? First one is the lateral pectoral. Second one is musculocutaneous. The third one is the lateral root of the median nerve. Okay, so lateral cord continues as which nerve? It's the musculocutaneous nerve. Let's coming to the branches of medial cord. Medial cord has medial pectoral nerve, just like lateral pectoral nerve of lateral cord. Here medial cord has medial pectoral nerve. Next, instead of musculocutaneous nerve, here it is having medial cutaneous nerve of arm. That means it supplies the medial part of the arm. Same medial cutaneous nerve of forearm, ulnar nerve, and also the medial root of median nerve. medial root of median nerve. These are all present in case of the branches from the lateral cord. Okay, first branch, just like lateral pectoral, here is a medial pectoral. Instead of musculocutaneous, there are three branches extra. Here, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and also the ulnar nerve. And lastly, there is a lateral root of the median nerve. Here is a medial root of the median nerve. These are the branches of the lateral cord. Now, what about the branches of posterior cord? Posterior cord, the first branch is not the first branch, but for the mnemonics, we are saying that a radial nerve. Next is thoracodorsal nerve. Thoracodorsal nerve. Upper subscapular, lower subscapular, and axillary nerve. These are all the branches from that of posterior cord. Okay, so from medial to lateral, what are the structures that are forming is, I'm just removing this. From medial to lateral, what are the structures that are forming is initially the roots, followed by the trunks, which forms the divisions, then the cords, and finally the branches. Right? So mnemonic is RTDCB. RTDCB. Just remember in this sequence. Roots followed by the trunks followed by divisions followed by cords, and cords followed by the branches. RTDCB. This is a brachial plexus from medial to lateral. Okay. First I had said brachial plexus, where in that first we have introduced about the spinal nerve. In that only the ventral rami are forming that network. That means one nerve will fuse with the another nerve like that. That's the network. Whatever the network which we now discussed in this image. So like that network is forming at the level of which structure? Ventral ramus. So ventral ramus of C5 to T1 together forms a network that is called as brachial plexus. It is not the entire spinal nerve. It is only the ventral ramus of C5 to T1 that's formed the brachial plexus. This is the third time I am repeating because how much important it is, just to understand. Okay, everyone thinks that the C5 to T1 spinal nerves. These are the spinal nerves that are including. It's a part of the spinal nerve. What is that part? Specifically the ventral ramus. Okay. So that part where the brachial plexus is originating, that is called as roots. Roots forms trunks. Trunks forms divisions. Divisions forms cords. Cords forms branches. So this is the sequence from medial to lateral for the formation of brachial plexus. Okay. Sometimes, usually it is from C5 to T1. Sometimes it is from C4 to C8 only. That means one step ahead. Here is C5 is originating, but one step ahead is C4. So here also one step ahead, that is C8. So C4 to C8, that is called as prefixed brachial plexus. So the network is formed from C4 to C8, that is called as prefixed brachial plexus. And the network, if it is one step below, that is from C6 to T2, that is called as postfixed brachial plexus. Postfixed brachial plexus. Okay. C4 to C8 origin is one step ahead. That's why it's called as prefixed. One is one step below. That's called as postfixed brachial plexus. So prefixed and postfixed is one step above, one step below of the spinal nerves for the formation respectively. Out of these, roots and trunks are present above the clavicle. So simply to say supraclavicular. Whereas cords and branches are present below the clavicle. So they are called as infraclavicular. Whereas divisions is behind the clavicle. So they are called as retroclavicular. Very important. Where they are exactly present. Roots and trunks are present above the level of clavicle, called as supraclavicular. Divisions are present behind the clavicle, retroclavicular, and below the clavicle, the cords and the branches are present. So that's why. So see the what is the apex of axilla is forming? It is anteriorly the clavicle, right? So after the clavicle, now they are entering as cords. So that's why we had said axilla content is cords of brachial plexus. It's not the entire brachial plexus that is present. It's the cord of brachial plexus that is present in that of axilla. And these cords are named after with relation with that of second part of axillary artery as medial cord, lateral cord and the posterior cord respectively if it is present on the corresponding sides. So this is the overview of the brachial plexus. Until now we hadn't discussed about the root value of any branches. See, branches has to be a certain root value where they are actually originating these fibers from which spinal nerve they are originating. So that is called as root value. But that there is a simple thing. Here lateral cord is there, right? And lateral cord is forming from anterior division of upper trunk and anterior division of middle trunk. And how the upper trunk is forming? Upper trunk is formed by C5, then C6, whereas middle trunk is formed by C7. So can we say the lateral cord is actually a mixture of C5, C6 and C7? Yes or no? C5, C6, C7. So that's why I had the root value of all the branches in the lateral cord, that is lateral pectoral nerve, musculocutaneous nerve, lateral root of the median nerve has the root value of C5, C6 and C7. C5, C6 and C7. Why? Because the upper trunk and the middle trunks are giving the anterior divisions, and these anterior divisions are forming that of the lateral cord. So where does upper and middle trunks are coming from? It is from C5, C6, C7. That's why it has a root value of C5, C6, C7. Either of the three nerves has the same root value. Now coming to that of medial cord. Medial cord is coming from anterior division of lower trunk. And how the lower trunk is formed? It is C8 and T1, right? So all the here is formed by C8 and T1. C8, T1. C8, T1. C8, T1. Except for ulnar nerve. Ulnar nerve is having C8, T1. Apart from these, some of the fibers of C7 has a minute connection with that of ulnar nerve. So that's an exception, that C7, C8 and T1. Once you understand the plexus, then it is easy to understand the root value. Right? Once again, I am saying why the root value of all the branches of lateral cord is C5, C6, C7. How the lateral cord is forming? First you understand that. It is forming by anterior division of upper trunk and also the anterior division of middle trunk. So upper trunk is involved, middle trunk is involved. How upper and middle trunks are formed? It is from the roots of C5, C6 and C7. That's why the root value of any branches of lateral cord, it has to be C5, C6, C7. That's what I had mentioned here. Now how the medial, what is the root value of medial cord branches? Now understand how the medial cord is formed. Medial cord is formed actually from the anterior division of lower trunk, and lower trunk is formed from C8, T1. That's why all the branches of medial cord is having C8 and T1. Exception is ulnar nerve, where it consists of C7, C8 and T1. Why, sir? There are small minute fibers of C7 also will be going to the top ulnar nerve. That's why there is an exception that C7, C8 and T1 has to be there. Okay, that's the part of branches root value of the medial cord. Now the complexity begins with that of posterior cord. How the posterior cord is formed? It is by the posterior division of all the trunks. That means all the root values from C5 to T1 are present. For that, only the radial nerve is having from C5, C6, C7, C8 and T1. That means all the root values are present in which branch? It is the radial nerve. Sir, what about the thoracodorsal? It consists of only C6, C7 and C8. Whereas upper, lower, subscapular and also along with the axillary, it is C5 and C6 alone. Because majority of the posterior cord branches are derived from the posterior division of upper trunk. That's why majority of the branches is also having C5, C6 root value. right? So C5, C6 is for upper subscapular, lower subscapular, and axillary, whereas all the root values are present in the radial nerve. And thoracodorsal has only three, that is C6, C7, and 3 C8. Okay, these are the root values. Okay, if you remember these root values, then only you can understand what is clinical anatomy related with this. If you don't understand this, there is no point of understand. You have to by heart. But by hearting is not the thing that we want. We need what actually the concept, why it is so, right? So please better understand the things of in the root values. So how the brachial plexus you have to study. First, what are the root values from C5 to T1, and which part of the spinal nerves it is forming? Only the ventral rami. So that starting point of ventral rami is called as roots. How the roots are forming into trunks, how the trunks are forming into divisions, how the divisions are further forming as lateral, medial, and the posterior cords. Why they are so called medial, lateral, and the posterior, based upon second part of the axillary arrangements, and what are the branches of each cord, and how these cords are forming, how the root values are derived. Everything I had explained. Just replay it, and then you can understand what is exactly. Next, uh, what are the root values of different branches? Now we will be entering into the clinical anatomy. So till now we discussed about the branches which are present from the cords, but there are certain branches which are coming from the roots and from also the trunks. What are those branches? We will see. From the C5, there is only one branch that is called as a dorsal scapular nerve or nerve to rhomboids. Dorsal scapular nerve, also called as nerve to rhomboids. That's the first branch from the root. The second branch from the root is C5, C6, and C7. These three together will constitute for long thoracic nerve. Long thoracic nerve, which will supply to the top serratus anterior. There is the branches from up the roots. Now, what are the branches from the top trunks? Is only upper trunk will give the branches, and that branch which is going above and one branch is going below. The upper branch is called as suprascapular nerve, whereas the lower branch is nerve to subclavius. Okay. So these are the branches from roots and trunks. I'm highlighting those with yellow color. Dorsal scapular, which is having the root value of C5. Dorsal scapular, which is having root value of C5. Whereas long thoracic nerve is originating from roots of C5, C6, and C7. Suprascapular nerve from the upper trunk. How the upper trunk is formed? C5, C6. And now to subclavius. How the nerve to subclavius is formed? Again, from the upper trunk, it is C5, C6 fibers are present. So dorsal scapular, long thoracic nerve, suprascapular, and now to subclavius. These are all the branches from roots and trunks. In other terms, roots and trunks are present above the clavicle or below the clavicle? It's above the clavicle. So in other terms, can I say what are the branches which are coming above the level of clavicle? Means can I say all these four? So the question arises, what are the supraclavicular branches of brachial plexus? So these are the things. Long thoracic nerve is one thing. Dorsal scapular are now to rhomboids. Suprascapular are now to subclavius. The specification is whether they, you know what are the things present above the clavicle or below the clavicle. That's what we have said. Supraclavicular, present above the clavicle. Which one? Roots and trunks. And roots, trunks, branches are which are highlighted in the yellow color. There's a dorsal scapular, all these things. Now, what are the branches below the level of clavicle? It's all the branches from the lateral cord, medial cord, and the posterior cord. Okay. Question: which of the following branches is not present below the clavicle? They will give three options as lateral pectoral, radial nerve, medial pectoral, and one option as any of these four nerves. And go for now to subclavius. For example, if it is given, okay, only four branches. Please remember these branches are present from the roots and trunks. That means they are present above the level of clavicle. That means the supraclavicular branches. The remaining are all infraclavicular branches, right? So that's about the entire branches of brachial plexus. Next, shifting to the clinical anatomy of these brachial plexus. In that, two things are present. One is upper trunk injury, the other is lower trunk injury. Upper trunk injury, lower trunk injury. Two things are present here. Upper trunk injury is also called as Erb's paralysis. Erb's paralysis. Whereas lower trunk injury is called as Klumpke's paralysis. Klumpke's paralysis. So how to identify these upper trunk paralysis and lower trunk paralysis? First, you have to understand Erb's point. What is meant by Erb's point is we have C5 root, C6 root. C5 root and C6 root is fusing to form upper trunk. And upper trunk is having anterior division and posterior division. So this is the upper trunk. And what are the branches that are present in the upper trunk? Two branches are coming from the upper trunk. One is going upwards, that is called as a suprascapular nerve. The other is going downwards, that is called as nerve to subclavius. Suprascapular nerve and nerve to subclavius. Suprascapular nerve will supply to supraspinatus and infraspinatus, whereas nerve to subclavius will supply to the subclavius muscle. Now this here, there is a meeting point of 6 nerves. See here. First one is the C5 root. Second one is the C6 root. Third one is the anterior division of upper trunk. Fourth one is the posterior division of upper trunk. Fifth one is the suprascapular nerve and the sixth one is nerve to subclavius. So this meeting point of all these 6 nerves is called as Erb's point. This is called as Erb's point. Erb's point. It's a meeting point of 6 nerves. So what if it is injured? The upper trunk is getting injured. When it gets injured is when you fall from above down. That means if you fall from a height where you had striken the ground between the head and that of the shoulder like this, then there will be a stretch in the upper part. That means there will be a stretch. There is a tension in the upper trunk also. That may leads to damage of this upper trunk. That's the other Erb's point. At that point, what are the things that will be damaged is we have C5, C6 roots damaged means what are the branches having C5, C6 root value? C5, C6 root value, what are the branches? Just now we had discussed the root value. That means it's the musculocutaneous nerve. Major nerves are musculocutaneous nerves. Axillary nerve is also having the same root value, the C5, C6. Even upper and lower subscapular, but does not have much effects. Okay. Next, radial nerve is also having it. Right. Musculocutaneous nerve actually supplies the anterior compartment of the arm, which helps in flexion. Anterior compartment of arm that helps in flexion at elbow joint. Whereas axillary nerve will supply to deltoid, which helps in abduction at the shoulder joint. Whereas radial nerve, it supplies to supinator muscle and also brachioradialis muscle. Supinator is the one which helps in supination at the radio-ulnar joint. Supination at radio-ulnar joint, RUG. and brachioradialis is the flexion in the mid-prone position. Flexion in mid-prone position at elbow joint. These are the overview of these nerves. Till now we hadn't discussed the nerves. After this session we will discuss about these nerves. But I am giving the overview. If in the musculocutaneous nerve, what is the root value of the musculocutaneous nerve? Just go back. It's a C5, C6 and C7. What is the root value of axillary nerve? C5, C6. What is the root value of radial nerve? C5, C6, C7, C8 and T1. This is what we had discussed under the root values. So here C5, C6 is involved in the injury. Here C5, C6 and here also C5, C6. Okay. So complete injury is in the axillary nerve. So if C5, C6 is damaged due to, that is at the Ives point, if there is some trauma is there and the nerves got broken. At the time, if musculocutaneous nerve is also damaged because it has the same root value of C5, C6, if it is damaged, then it does not have any supply to the anterior compartment. That means it does not have any flexion at the elbow joint. So if there is no flexion at the elbow joint, what will be the effect at the elbow joint now? It's an extended elbow. So effect is extended elbow. Now coming to axillary nerve. Axillary nerve is supplying the deltoid which helps in abduction of the shoulder joint. That means moving away from that of the midline. This is called as abduction. Now this abduction, will it be present if there is a damage to the top C5, C6? No. So axillary nerve is damaged, no supply to the deltoid and there is no abduction at the level of shoulder joint. That means adducted shoulder. And radial nerve is a partial injury because the C7, C8, T1 are still persistent. Only C5, C6 are damaged in the radial nerve. So once it is damaged, then there is no supply to supinator and the brachioradialis. If no supinator to that of the radioulnar, there is no supination of the radioulnar joint. So what will be the opposite effect? There will be a pronation at the elbow joint and flexion at the mid-prone position. There is even the flexion at the mid-prone position. It is very difficult. So this extended elbow, adducted shoulder with pronated elbow. So the effects whatever you had seen because of these injuries of the nerves, one is the extended elbow, second is the adducted shoulder and the pronation of the radioulnar joint. It's not the elbow joint, it's a radioulnar joint. And all these effects is just like a policeman is asking for a bribe. That's why it's called as policeman tips. Is he will keep the hand in that position. Okay, this is what regarding the entire part of Ebb's paralysis. I'm saying again the crux. The clinical anatomy, there are two things. One is upper trunk injury and the other thing is the lower trunk injury. Upper trunk injury is when you fall in the upside down so that there is a contact between the head and the shoulder. So there is a stretch at the neck. And there is a stretch at the neck, then there is a damage of the upper trunk. And what are the things at the upper trunk is present is 6 nerves, C5 root, C6 root, anterior division and posterior division of upper trunk, and from the upper trunk 2 branches. One is suprascapular, the other is subclavius. Out of these, the major nerves damage having the root value is C5, C6 is one is the musculocutaneous, axillary and the radial nerves. Musculocutaneous, it causes a flexion of the elbow joint because of it supplies the flexor compartment of the arm. Axillary nerve, it supplies the deltoid for the abduction of the shoulder joint. Radial nerve, it supplies the supinator and brachioradialis, and supinator is for supination of radioulnar joint and brachioradialis is the flexion at the mid-prone position. So whenever these are damaged, then elbow flexion is lost. That's why there is the extended elbow. Abduction of shoulder is lost, adducted elbow, adducted shoulder. Supination of the radioulnar joint is lost, that's why it's the pronation of the radioulnar joint. All these effects is called as policeman's tip. Apart from these, there is a nerve to suprascapular nerve damage is there. And now to subclavius, because they are also the branches. Suprascapular is actually supplying to supraspinatus and infraspinatus. Supraspinatus and infraspinatus. What they are actually doing is it causes the lateral rotators. These are lateral rotators of shoulder joint. Lateral rotation of the shoulder. So whenever there is no lateral rotation because of damage of these nerves, there is no supply to supraspinatus and infraspinatus, and there will be no lateral rotation of the shoulder joint that causes the medial rotation, and that is also one of the feature for these policeman's tip. So these all changes together. Why these are all changes? Because of these corresponding nerves which are affected. So please remember these nerves and what are the effects. If you just want to buy hard the things, you can buy hard. There is no thing in it. But if you understand in a stepwise sequence, that will be more beneficial. Okay. So that's about the Erb's paralysis. Next, coming to the lower trunk injury called as the Klumpke's paralysis. Klumpke's paralysis. How the lower trunk is formed? Is by C5, C6, C7, C8 and T1. C8 and T1 together is forming the lower trunk. And there are no branches here. And it consists of again anterior division and the posterior division. Now, how there is an injury for the lower trunk is, if you are falling from a height and suddenly you had hold a support, then sudden there is a, due to that gravity, there is a sudden pull from the downwards and you had kept here like this. So whenever it's kept here, there is a stress in the level of the axilla, and stretch at the level of axilla causes the stretch at the lower trunk also. So that's why there is a lower trunk injury. Okay. So lower trunk injury is called as a Klumpke's paralysis. In that, the root values is C8 and T1. C8 and T1 is majority with the of ulnar nerve. Ulnar nerve is having C7, C8 and T1 is the root value, and C8 is T1 is a major fibers. Only minute fibers of C7 are present. So once C8 T1 is damaged, almost entire part of the ulnar nerve is damaged. Ulnar nerve usually supplies the intrinsic muscles of hand. Intrinsic muscles of hand, particularly the lumbricals and the interosseous. Lumbricals and interosseous. What are the functions of these lumbricals and interosseous? Lumbricals is just keep the letter L. Can you see the letter L like structure, inverted letter L? So it causes, what is the level at the metacarpophalangeal joints is flexion, and at the level of interphalangeal joints it is extended. So these lumbricals along with the interosseous together have the functions of flexion at metacarpophalangeal joints and extension at interphalangeal joints. So whenever there is a damage to the of ulnar nerve, then there is a damage to the of intrinsic muscles. There is no supply to these intrinsic muscles of lumbricals and interosseous, and there is no flexion at the metacarpophalangeal joint, no extension of the interphalangeal joints. If there is no flexion of the metacarpophalangeal joint, what is the effect? It is the extension at metacarpophalangeal joint. This is the effect due to damage, and there is a flexion at interphalangeal joints. So just like this. So there is an extension at the metacarpophalangeal joints and the flexion at the interphalangeal joints, and this condition is called as claw hand. Claw hand. So Klumpke's paralysis effect is claw hand, and this is a motor effects. What about the sensory effects? Is it C8T1? So it is a C8T1 actually supplies the medial part of the hand and the forearm. So sensory loss of medial hand and forearm. And T1 is the outflow for sympathetic nervous system. We know that thoracolumbar outflow, that is T1 to L2 is sympathetic. So T1 has outflow for sympathetic for head and neck. Sympathetic nerves, sympathetic outflow for head and neck. So whenever there is a damage of T1, will the sympathetic will still supply to the top head and neck region? Because they had got cut. So that means there is a damage to the top sympathetic. So T1 if it's cut, outflow sympathetic is also lost. So what are the effects is? One is constriction of the pupil called as meiosis. And there is no sweating on the side of damage, that is called as anhydrosis. And there is a for the elevation of this upper eyelid, there is a levator palpebrae superioris which is supplied by sympathetic nerve. but sympathetic is not there. So that then upper eyelid will be like this. That is called as ptosis. Ptosis means the drooping of eyelids. Ptosis. And all this makes that the eyeball is sunken deep inside. That is called as anophthalmos. Okay. So T1 is having the sympathetic outflow, and this sympathetic outflow is damaged because of this lower trunk injury. So whenever it is damaged, then automatically the effects of parasympathetic will be more in case of head and neck region on the side of damage. So for example, right side trunk is damaged. So right side sympathetic will not be there in the effects on the right side of the face. So what will be there? The parasympathetic effects will be there. So what are those? Is meiosis, the constriction of pupil, anhidrosis. There is no sweating on the side of the face. Ptosis, that means the drooping of eyelids, and anophthalmos, it appears that eyeball is sunken deep inside because of this ptosis. So these all effects together is called as Horner's syndrome. So together, claw hand, sensory loss of the medial hand and the forearm, and the Horner's syndrome. These three together constitutes Klumpke's paralysis.